Approximately 20% of chronic low back pain originates in the sacroiliac joint. But because SI joint dysfunction can mimic other etiologies, with pain presenting in the low back, buttocks, down the leg, and sometimes in the groin, it is often overlooked. The Symmetry Sacroiliac Joint Fusion System is the minimally invasive surgical treatment founded on proven orthopedic principles of joint decortication, bone grafting, and fixation. The key is the Symmetry Decorticator, which removes cartilage and decorticates the articulating joint surfaces. The cavity created allows placement of bone graft. The result is a true SI joint arthrodesis and the best possibility of relief for your patients. To begin, a guide pin is used to target the SI joint and ensure a final position within the safe zone of the sacrum. A dilator and working cannula are then inserted to create a channel through which a drill accesses the joint. The drill flutes collect autologous bone from the ilium for later grafting. After docking the working cannula to maintain position, the drill is removed and the sacral surface is prepared for decortication with a scraper and suction. The Symmetry Decorticator is then inserted so that its cutting element is in the middle of the joint. Each turn of the knob extends the cutting element into the joint space. As the handle is rotated, the element tracks the joint to remove cartilage and create opposing bleeding surfaces. Loose tissue is removed, leaving behind a prepared space for bone graft placement. A mixture of the collected bone and graft extender is then pressed into the prepared fusion bed. Next, the guide pin is inserted to its final position in the sacrum, and a pilot hole is drilled to accept the implant. The final sleeve is inserted over the working cannula, and the working cannula is removed. Marks on the guide pin assist in selection of the appropriate implant length. The implant is then delivered and securely tightened against the outer ilium. A second implant provides additional stabilization by preventing joint rotation. A safe trajectory is once again established using the guide pin, and a new access channel is created through which the implant can be placed. After determining the length, the second implant is delivered and securely tightened to complete the fixation construct. The Symmetry Sacroiliac Joint Fusion System is built on proven orthopedic fusion principles: joint decortication, bone grafting, and fixation with threaded implants. The result is a true SI joint arthrodesis and the best possibility of relief for your